Welcome back to Healthy Living. We're talking today about levels of care. We talked first with Dr. Catherine Pichon from the Madisonville Primary Care Clinic. She spoke about family practice and primary care. Next, we talked with Kira Smith, who talked about express care and urgent care. Last, we're going to visit with Rebecca Wood, who runs the Mandeville Emergency Department for St. Tammany Health System. And Rebecca will be talking with us about emergency services, about trauma, chest pain, and stroke care at the main emergency department, as well as specialty emergency options for pediatrics and a freestanding convenience in Mandeville, which is where she manages a group of professionals who focus on emergency care. So Rebecca, thank you so much for joining us.
Thank you. Thanks for having me.
Glad to have you here.
Yeah.
So tell us first about what qualifies an emergency department as a trauma center.
So we at St. Tammany Health System at our main campus in Covington, we have specialties on call for 24/7. So at any point in time, day or night, we have those specialties there to be able to stabilize and treat our patients, particularly general surgery that does a lot of surgery on our trauma injuries. Last year, we became a level 3 trauma center. Okay. So we're able to care for those traumas that happen in and around the area, and we actually get transfers in from other facilities.
So that trauma level designation suggests that the surgeons have particular capabilities and are on shift and ready, or on call and ready, depending on the specialty.
Yes.
So if there is a neurosurgery emergency or there is an orthopedics emergency, that those specialists are at the ready for that trauma. But there are a couple of other designations at the main emergency department, and one is an accredited chest pain center. Yeah. So tell me a little bit about why someone should care about a chest pain center.
So we were actually just accredited for the 6th time to be a chest pain center. So we are well equipped with a fancy words called percutaneous intervention. So our patients are able to come in if they're experiencing a heart attack. We can quickly get them to our cath lab, which would be able to ideally open up that vessel that's causing that occlusion. So patients with chest pain that come in, our staff, both at the main ED and the Mandeville ED, are well equipped to rigorously and quickly identify what's going on. And there's a process that happens. It's all very fast, and sometimes we have to explain to the patient a lot's going to happen in a very short period of time to get them stabilized to go to the cath lab.
Wonderful. And that door to dilatation time, that very short span of time from the time someone presents with chest pain to the time we're opening up those vessels, the shorter that amount of time, the more heart muscle is saved.
Correct.
And that's why you want an accredited chest pain center.
Yes.
Such as St. Tammany Health System.
Yes, correct.
Very nice. Similar, we're talking about, that's our recognition for heart care in the emergency department, but we're also a certified stroke center. And we say time is brain, and we try to teach people be fast. So we teach them about the symptoms that they may see in someone who may be experiencing a stroke. And when someone comes into the emergency department, whether via 911 and the ambulance or via their own transportation, that stroke response also needs to be very fast.
Yes.
So talk a little bit about that.
So the our stroke team, we have a stroke coordinator, all the ER physicians, staff, it's not only just nursing and physicians, it's a whole team that that's a part of this, but the response to stroke is very quick as well. We're all educated to quickly identify those symptoms and get you to the best possible care. And for the most part, you'll probably stay at St. Tammany and get that, whether it be that medicine or the intervention that you need. And if it is a higher level, again, our partner hospital on the South Shore is equipped to take care of that.
Brilliant. So whether someone is experiencing trauma, heart attack, or stroke, St. Tammany Emergency Services are ready and wearing their certification badges. They can do it fast and they can do it right.
Yes, absolutely.
So that's the main emergency department,
Yes.
and that can be a very busy place we've just described.
Yes.
Adjacent to and a part of that is a place that's a little corner of the universe very specifically designed for children and parents.
Yes.
Can you talk about that?
So at our main campus in Covington, we have a separate pediatric emergency department staffed with pediatric nurses. They're all well educated and specialize in pediatric care. A lot of emergencies are different for pediatrics, or a lot of, I should say, resulting injuries are different for peds than for adults. So we're all well equipped to take care of that.
Fantastic. So if we start off thinking about those really big emergencies like we were just talking about, accidents, incidents, heart attacks, strokes, the main emergency department is a really busy place with a lot going on. Mm-hmm. And then we've got the pediatrics emergency department that is focused on what may be happening to children, and we've got a way for their parents and for those kids to have the care that they need and maybe not feel quite as much in the rush and crush of what's going on in the main ED. But if we have adults who are maybe experiencing something pretty urgent, feels like an emergency, mm-hmm. very worried that they need emergency care, and they may be closer to Mandeville, or even if they're somewhere close to Covington, but the wait at the emergency mm-hmm. department for someone who is not in one of those life-threatening situations is a little long, there is an option called the Mandeville Emergency Department.
Yes.
So can you talk a little bit about that one?
Sure. We are a freestanding emergency department in Mandeville. It's actually on Highway 190 or 22, whatever you want to call it, Emerald Parkway, across from the post office. So very close to like the Causeway approach and the Causeway itself. But we are a 9-bed emergency room. It's the same physicians that work in the main ED. We're staffed with nurses. We have CAT scan capabilities, x-ray, ultrasound. We have a point of care lab on site, which does about almost all of your emergency labs that you would need to diagnose any issues that were going on. We're equipped to take care of broken bones, abdominal pain. If you do come in and you're having chest pain or stroke, we're very well partnered with our local EMS agencies to get those patients over quickly to our main campus. If it's any surgical intervention, again, EMS will take our patients over to the main campus. So it's a great, usually our wait times are shorter, so patients and families can use the wait times on our website, the St. Tammany Health.
St. Tammany.health.
That's St. Tammany.health, yes. And check the wait times, and then most of the time our Mandeville wait is a lot shorter.
Very good.
Yes.
So essentially, regardless of what kind of an emergency someone is mm-hmm. having, St. Tammany Health System has the resources and the accreditations, the specialists and the team to save lives and to get people back to normal.
Absolutely.
Fantastic.
Yes.
Well, thank you so much for coming in, Rebecca, and talking with us about emergency care.
Thank you. Thanks for having me.
It's a pleasure to have you here.
Thanks.
This has been an episode of Healthy Living brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we were talking today about finding the right level of care when you need it. We examined family practice and primary care, express care and urgent care, and then we talked about emergency services options for trauma, stroke, heart attack, and for incidents and accidents in Covington and in Mandeville. Next time on Healthy Living.